Hi, this is Dr. Farley. In the blog today, I want to be going over an article out of Brain Behavior. Actually, the title is called Brain Behavior and Immunity, and it's was published in February 2017. And basically, we're talking about the brain-gut axis and the gut-brain axis and how they play on each other. And I just want to read this. It says, basically, affecting millions of individuals annually, traumatic brain injury represents the leading cause of morbidity and mortality worldwide in individuals under 45. In addition to the acute symptoms following neurotraumatic events, there's increased evidence that long-term biological sequelae of these injurious events may increase the risk of neuropsychiatric disorders such as depression. I would even throw in there anxiety, bipolar, schizophrenia later in life, while also contributing in part to the pathogenesis of neurodegenerative disease. So I have a lot of patients coming in that are showing signs of neurodegeneration, whether they're Parkinson's, Parkinsonian, MSA, P5P, dementia, Alzheimer's, weird neurology, and they don't realize that injuries that they may have had, either from repetitive sports injuries, a couple car accidents, maybe nothing significant, but enough to create this imbalance here. Or over a time frame, it could be something as simple as that you hit your head and you saw stars. It really depends upon the adaptability of the person when they get into the injury as to what the outcome will be. Will they get major consequences and create a rapid decline in their brain and show up as neurodegeneration in the next 2 to 5 years? Maybe. Might it take 15, 20 years? Yes. Or might they not get any of that? The answer is yes. It's always about the current state of adaptability. So when you're coming to me and you're asking me for help with whatever, I don't care whether it's a chronic patient, chronic neck pain, back pain, discs, herniations, we must consider the brain always. So not only does the brain create these direct brain symptoms, and in this case, gastrointestinal issues and other issues, but also it creates tight muscles in my neck and my back and my hips and my knees, and then I need knee replacements and hip replacements or back surgery or neck surgery. And then all of the neurodegeneration patients, we need to realize this. I know that you go in and they tell you, oh, you have Parkinson's or Parkinsonian, here's the drug, try it. And maybe the drug works and maybe the drug doesn't. Either way, the drug is not required for health. If it helps manage the symptom, you may use it for a little bit, but sometimes the side effects are terrible. On a long-term basis, it will speed the degeneration, no doubt, in every single person because drugs are not required for health. And every time we take one pill for anything, we're adding more to our allostatic stress load, driving our health down. So when you look at the outcomes of some of these patients, a Parkinson's patient, it says 5 to 8 years from diagnosis to death. In my opinion, I would say to myself, why would I even go there? If that's the outcome that they're getting, try something new. Try going and looking for someone like our office here that's measuring, trying to figure out why, what are the root functional causes for why the brain is breaking down. Set up a plan of action to address those causes and give yourself a chance. You deserve a chance and not just rapid degeneration and continued drugs and drugs and drugs, higher and higher and higher, which only over time speed the degeneration and absolutely lower your health and move you closer to death on a long-term basis. They are not required for health. You may decide to use them to help manage a symptom, but you should always be looking for root functional causes specific to you. Thanks. Have a great day. As always, any questions, let me know.